With relation to the accreditation and regulatory agencies involved in doing surveys and reviews at Kearney County Health Services, there is very little done. They use, through the CHA Hub, which is Good Samaritan Hospital for KCHS, peer review of medical records and of incidences within the facility. The main survey done is the Nebraska Department of Health and Human Services Hospital Survey. This is done approximately every 2 years. However, the DHHS has been backed up and has not been able to survey the facility for some time. With the current remodeling going on, however, likely the DHHS survey will occur shortly after the remodeling is completed, which is the fall of 2013. One of the smallest departments in the facility is the Quality Assurance Department. It is made up of one person, Connie Jorgensen. She is an LPN and is the director of the facility for quality insurance, which the facility has decided is a better title than performance improvement. She oversees the department and works with the physicians, medical staff, as well as other departments such as medical records, all the outpatient services, safety, the medical clinic, and all contracted services. She does things like make sure all of the physicians and providers hired are properly credentialed, as well as keep up with their ECU every year. She works as well with the Critical Access Hospital Hub Center, Good Samaritan Hospital, for peer review of patient records periodically. She also submits reports that are required when incidences occur in any part of the facility involving patient injury or a patient or family member complaint. The utilization review at KCHS is done through 2 personnel members who actually have differing jobs in different departments. Amanda Warburton is the facility's behavioral counselor, and Mary Bunger, who's the director of nursing. Overall, the only type of utilization review that is done through them is verification, continuation, and discharge of patients related to their insurance company coverage. They work with the Health Information Department when there are additional requests for information that may not be in the patient's electronic health record, or when specific diagnostic codes are requested. Most information, however, is obtained through the patient's electronic health record. Rebecca, the Human Resources Director, has only been at the facility since August 2012 and has not gone through the majority of the processes that I was interested in. She could explain what the various policies were, but could not speak from first-hand experience in the processes themselves. Job description application was one that she was familiar with, but had not participated in. She explained that the department director, when they find themselves in need of a new position, would bring the need to her. She will go over with the department director the job description that the director feels necessary, including education, experience, and number of positions that this description may require. Rebecca will then write up the description and go back to the department director with the formal job description to verify that this is what was wanted, making any corrections as necessary. The next step would be for Rebecca and the department director to meet with the leadership team to get verification of the need for the job as well as approval for the job description. When the approval is given at that level, then the job description and need will be forwarded to the CEO of the facility, Fred Meese, who will then approve or disapprove the job description and necessity for hiring new personnel. Once this process has been done, the hiring begins. Rebecca is the only member of the personnel department, so there are no interdepartmental meetings. Rebecca also works with the department directors when issues involving personnel problems in the department. Overall, the department directors tend to care for these issues themselves. However, there are times that they cannot be resolved, and then Rebecca becomes involved. The facility works hard to use situations and employee disputes as a learning event for all involved. They work at educating the employee or helping where possible if the issue is related to personal problems the employee may be having. If nothing can be resolved after 3 times of corrections and discussions, the employee will likely be terminated from their job. KCHS uses a cooperative job evaluation type system. The employee fills out a performance appraisal form, and the department director also fills one out. They then schedule a meeting to discuss their combined results and why the director has filled in the comments and concerns he or she has. At the end of the meeting, they both sign the original appraisal. The director gives a copy of the appraisal and a copy of the performance evaluation comments to the employee, and the originals are placed in the employee's employment record. This is done annually and is the basis for wage increases. Coding in Kearney County Health Services is done by two persons, one full-time RHIT and one HIM student. DRGs are not used in this facility. There is only one type of disease index, the tumor registry, kept at this time within the facility, and is kept by Melissa, who is also the clinic transcriptionist. This is updated on a monthly basis, and all information that must be sent into the state is done so also on a monthly basis. She accesses the registry from her desktop computer for easy access and updates. On January 24, 2012, the facility became a hybrid system. The two major facilities, the hospital and outpatient encounters, EHRs, are used. However, the clinic and long-term care do not use EHRs, though they have both chosen EHR programs and will be transitioning to them in the near future. The medical clinic did choose to go with the same program as the hospital is currently using. The transcriptions are transcribed directly to the EHRs. However, the clinic ones must be printed at this time and are hand carried to the medical clinic to be placed in the paper medical chart. In-house labs are uploaded into the EHRs. The results of radiologic encounters are not at this point able to be loaded into the EHRs. However, the reports are scanned into them. There are still various items that cannot be included due to the inability to communicate with outside EHRs or for the two facilities to communicate to one another. Kearney County Health Services is a small hospital, and as such, most of the providers on the medical staff committee with various jobs they are responsible for. Connie Jorgensen, Quality Assurance, is in charge of recording the meetings, writing them up, and preparing them for the next committee meeting.